Hey guys, Don here. Welcome to the Million Dollar Minute. I'm going to try to help you the best I can here every day to get you to the $1 million mark and beyond. Kind of share what's top of mind these days. We've been playing around with Google Local Business. So this is a product that's rolled out for Google for local businesses in the community. And it recently opened up to doctors. Now, I'm going to kind of talk about the good and the bad. Well, the bad is you really don't write your own ad. It's different than AdWords. It actually shows up when someone is searching for podiatrists, and it has a phone number. So they are going to call the office for an appointment, which is a good thing. You get a little email every time someone does that. And what we were able to do is we created a spreadsheet for my staff, and they uploaded all the phone numbers there, and then they cross-referenced them to see if they were patients already or if they had made an appointment. Basically, we weren't cross-referencing to see if they were patients. We were cross-referencing to see if they actually paid us money or made an appointment. And what we found is these ones that we're paying for, many of them were our current patients that were just looking for our phone number. So they were our current patients that were Googling us, looking to make an appointment, and they'd already had appointments. So those weren't really good leads. We didn't really find many on the Google Local Business that were trying to be new patients. So that was our experience so far. We're doing a test for a few months, and if there's a lot that are like that, and it might just be because we're well established in the community. But that was my thought about the Google Local Business. But let's get into the day here. This is a full day, 23 patients. The most valuable patient usually tends to be one of my orthotic patients, so I'm going to go over that first. This was a patient that he had bursitis to the 5th met, and we did 1 cortisone injection. He was feeling better, and I did a little offloading pad. What I do in their shoe is I cut out the area underneath the 5th met, and I kind of flip the liner back, and then I say that's kind of like the poor man's orthotic, and if that works, then we will do the orthotic. So he decided to do the orthotic, and then he'll come back after that. So that was pretty much my most valuable patient of the day, mostly because of the orthotic. So I try to get 2 pairs of orthotics per day. That's kind of what my numbers are, but I wasn't able to do that yesterday. So yesterday was I record this the day after, so it was pretty shockwave-heavy. But let's first start here. So the first one was a patient that came in with the neuroma. They were concerned about having a neuroma bilaterally. I had recommended anatomic shoes, and they tried to use the correct toes. It was kind of a challenge. In this patient, we ended up doing a cortisone injection for them. No follow-up, just in case that comes back, they'll come back. This is another patient that came in for the last EPAT, and usually for the last EPAT or shockwave sessions, I do a level 3 visit because I'm going over kind of what's next. I have a little handout I give all of them, and this kind of helps them to know what we're going to be doing next. And it's also something that they can give to physical therapists as well, because usually after they do shockwave with me, then they're going to physical therapy. Next patient was a patient that didn't really have good success with terbinafine, and I switched them over to diflucan. I tend to have like these, I start out with terbinafine. If that doesn't work, I'll go to diflucan, and then I have a couple of others down the road. That's kind of the way I do it. Another patient that came in, new patient, had pain to the sinus tarsi. I did a sinus tarsi injection, and they also had a concern about a nail, so I did a nail sample. They're going to come back in 3 weeks to go over that nail sample for that patient. I had a patient, Aaron. I've been seeing Aaron for a long time. He has been dealing with some chronic plantar fasciitis. Now, I think he's probably had the most shockwave ever. Okay, so I'm on shockwave in session 12. He is a nurse, and he's gotten much better. And I usually do sessions, so I did 3 and then 3, that was 6, and then he wanted, I think it got up to 12. I don't exactly know how it got that high. And he had and I keep counting, otherwise I forget how many I've done. That's why each time I label them. And he also had an amnio injection last time, and he's been wearing a boot. He is getting much better, but he's a young guy. He's a 41-year-old guy. Another patient that came in for an ulcer, and this was a patient that's kind of difficult to revascularize, and so he has this ulcer. I'm sending him to another vascular doctor for an evaluation to get more blood flow to help that ulcer heal. Another patient came in for metatarsalgia, visit 1. I recommended kind of a gel met pad. I like Dr. Jill's met pads. She does a good job with those pads and really helps for metatarsalgia. And if that doesn't work, the next step would I talk to her about orthotics. Another patient that was EPAT number 3. and she's been getting better. Another patient was a fracture follow-up, 5th metatarsal. That's doing well. Just a reminder, with fracture, if I do fracture code, I just do usually one follow-up and then no follow-up after that, just to make it more efficient. Another patient was metatarsalgia. Came in, got my typical number 1 for metatarsalgia, which would be shoe recommendations, meloxicam, contrast baths, things like that. It's really all musculoskeletal, get about the same thing, and then about a 3-week follow-up. There was a EPAT number 3, which was for plantar plate injury, and she's going to come back in 6 weeks. That's what I usually do after shockwave, would be 6 weeks. Another patient that came in, new patient, she had bilateral equinus. She got x-rays, ball of foot pain she had, and so the plan will be in 3 weeks to do ultrasound. She's going to be working on the equinus, which I think is a contributing factor to her forefoot pain. And she got the the icing, meloxicam, the contrast baths, and things like that. Another patient for EPAT number 2. This was a matrix follow-up patient, and this is one I'm trying to reduce the matrix follow-up. So this is one that was a 3-week follow-up. And so what I'm tending to do now to reduce, even though I think some of these matrices I have to see back, I can't just not see everyone back. So what I'm trying to do is when I schedule a matrix follow-up, I'm going to have them double book that, so they kind of know they can double book those to make it more efficient. Another patient was a patient that came in for a nail fungus that got, once again, diflucan. They got an ultrasound because they had bilateral foot pain, and they got cortisone injection. So this patient had a little bit of pain, and so I'm going to see this patient back in 6 months to see how they're doing for the diflucan, and then as needed for the cortisone injection. Another patient was an EPAT number 4. This was the last shockwave, and we're doing an 8-week follow-up. Another patient that came in for bilateral EPAT as well, and another patient that came in for ultrasound. I did the bilaterally and for the plantar fascia, and then they got correct toes, and the last one was EPAT 6, and with a 3-month follow-up. So usually I do, for the first 3 shockwaves, I'll do a 6-week follow-up, and then at the second 3, if I'm doing another 3, I'll do a 3-month follow-up. That's why it extends out a little bit longer. Anyway, that's the day. Hope you guys find that beneficial. A lot of shockwave. I was playing around with this idea about shockwave. It's kind of the same way I'm playing around with this idea of having a nail tech come in and having them only do morning days. The idea of the shockwave is if I could find someone, maybe like a physical therapy assistant or massage person that has technical skill, my thought is, well, you can see me for, let's say, $250 per treatment, or even I could increase my price. Let's say you could see me for, I'll keep it at $250, or you could see them for $150. And the thought would be, I'll be around, or one of the doctors will be around if you have any questions, but you could do $150 for that. Or even I can increase my price to $300 and reduce theirs to $200. That would be another option. And my only concern about that is some days I'm doing it the same day. I might do EPAT number 1 the same day I'm doing the ultrasound. So in which case I would do that, and maybe they could do the other 2. And then the other thing is usually the last one I'm getting an office visit, because I'm going in more detail of what's next, and maybe prescribing physical therapy and things like that. So they couldn't prescribe the physical therapy. They couldn't do the next visit. But I'm trying to figure out a way that I can do this. I know some doctors do 4 sessions, and you could just schedule them all out. So I could have them scheduled. I could say, okay, I could do it for you today, or you could schedule it with my assistant. The benefit of having an assistant, I've thought, is if I do it for a lower amount, what I could do is I could just have it all done, let's say, Wednesday morning. So I could get this person, they would only come in Wednesday from 8 to noon, and you would double it, you'd do it every 30 minutes, and they could do all these patients, and then you would just pay them a percentage. And to do that when a doctor's around, they could just use one room and just kind of whip them in and out, and then no one else would schedule it at that time. So it's just a way to increase the use of another employee. I'm just not sure about the office visits. You probably couldn't do those, but I think it would have some benefit. Even what you could do is you could give them the physical therapy prescription the first time, and then just have them schedule it for, because that's the way I do physical therapy after shockwave. You could have them schedule it after the last shockwave, and they would kind of do the 3 of them, and then they'd see you for a 6-week follow-up. So just a way to, I think, increase revenue. And look I did about, maybe 6 or 7 shockwaves yesterday. That would be 6 or 7 other patients that I could see. If you have the demand in your office, that might be worth it. Anyway, hope that was beneficial. Thanks.